everybody, and welcome back to Dr. Greg Jones's Optimization Academy, where I get to interview some of my favorite innovators in medicine and health and fitness and science and beyond. And today we have a very special treat. We have Dr. Grace Liu. So before I give her the formal introduction, we've seen each other at a couple of peptide conferences, and and she's super excited about peptides just like I am, and we've been geeking out and following each other on Instagram, and you know what, it's time to bring her on to the podcast now. So we're kind of at that point where we are ready, and I'm excited about this. So for those of you that don't know Dr. Liu, she is and are we going to go by Dr. Liu, Dr. Grace, what do you prefer?
Either way, or Grace. Yeah, Dr. Grace.
I'll use them all. I'll keep you on your toes. So Grace is a IFM trained functional medicine practitioner, a pharmacist by trade, and she's the founder of the Gut Institute. She is a clinical pharmacist with over 20 years of experience and specializes in complex disease management. She helps her clients gain optimal performance through rebuilding the microbiome after damage from modern living. And there's a lot of damage from modern living. She uses nutrigenomic tools and other advanced functional lab testing to give the solutions, strategies, and treatments that reverse modern gut dysbiosis and disease. Get ready for this motto, y'all, because I love it. The Gut Institute motto is bugs over drugs. So welcome to the show, Dr. Grace.
Oh, thank you so much for having me. It's such a pleasure.
So before we get into the meats and potatoes, the other modern living things that cause gut dysbiosis. So I'll say, before we get into the kale and chicken breast of this presentation here, I want to know a little bit about you. Like, how did you get from pharmacy school to getting into gut health and probiotics? So how'd you get from that to there?
Well, like a lot of practitioners who go into integrated functional medicine, I went from, we have a joke, right? There's two kinds of medicine. I got acutely ill. Like, it came about through, kind of rejection of a dental implant, a vaccine I probably didn't really need, and immune compromised state after that, and then severe toxicity with azenoprogestin. In the world of medicine, progestins, which are fake progesterone hormones, are incredibly toxic. So I had a form of intrauterine device, and it just killed my health. And I developed a lot of gut problems, immune problems. And although I work with a lot of experts in functional medicine, nothing really helped, and I had to really kind of dig in literature and look at the root of what was kind of going on. And I was really fortunate. There were enough people that pointed me in the right direction, and things started to heal after that. But there's no accidents. We always go through a spiritual journey, I believe. So it happened for a reason. So there's two kinds of medicine. One that's dysfunctional medicine, we call it, and then functional medicine. And so dysfunctional Western medicine pretty much hurt me a lot. And I had antibiotics growing up all the time. It was just, and I had Hashimoto's, I had obesity, a lot of insulin resistance, metabolic syndrome. I was morbidly obese at one time. And I'm really grateful I found, different diets like the paleo diet and functional medicines that helped me to bring my health, resurrect my health back, and my microbiome.
Oh, that's awesome. And again, it usually happens that way. Something happens, we get hurt. We feel ill, and we're not getting answers, right? And so for me, my training postgraduate was actually in orthopedic injections, like PRP and prolotherapy and all that, because I played sports growing up, was in the military. I never got hurt. I never had an injury, and I was working out right before medical school, and hurt my back on a biblical level of pain. Oh my God, at sciatica, I remember curled up in a ball in class, couldn't sit, couldn't stand. And, I saw a naturopathic doctor at the school, and we started doing injections and acupuncture and all these things. And I was like, you know what, at the time, I thought I was going to get into cardiology, and I was like, I want to be like a naturopathic cardiologist. And, just because, I have family with heart issues and high blood pressure. And I was like, oh, that's what I want to do. And then the pain hit. And once I saw that, I was like, this is the gift I want to give other people. And so I definitely understand what brought you there, because I think a lot of us do have that same journey to get where we are. Now, we are here today, though, to talk about the gut. It is all about the gut today, and not just the basics, hey, here's the digestive enzyme, right? And we talked about this a little bit before, there's the generic supplements, right? But I did that,
and they didn't work on my clients.
Oh, great. Yeah, saying well, this isn't cutting it, right? And so just taking these capsules and all that. It's like, oh, here you go. So when it comes down to it, and I we were talking through our topics for today, and I was like, hey, let's talk about some myth busting and some fact checking on gut health, right? Because a lot of times, you know, we mentioned the gut and gut health. What does that mean? You know, and
Yeah,
so
what does it mean? You know, the gut is like this dark, dark organ, black box. No one knows how to assess it. So if you can't assess it, how do you test it? How do you make a protocol for it? How do you diagnose it and have prognosis, right? We only know until it's really bad. Someone has colorectal cancer, Mets, you know, to the bone and head, brain, you know, or, you know, just severe diarrhea. They can't function, they can't work. But everyone actually in the Western world is shown that their microbiome is dysfunctional. And no one sleeps well. No one is calm and happy and feel harmonious and whole. Everyone has gut issues. There's a UCD researcher that showed that in the Western world, moms and their breast milk are completely bankrupt for the flora that really belong there when they compare to healthy individuals in Europe or other areas of the world where they don't use a lot of antibiotics and have little stress.
Yeah. And so from your experience and what you've been doing this for so many years now, when you're assessing gut health, what are you looking for?
So a couple things, we do testing for clients when they come to us. I'm kind of into the Western side where we want to show people, educate. I'm an education platform. The Gut Institute is largely very educational. And we want to teach people about their microbiome. You know, you can look at just the color, smell, and how what the stools are shaped. There's a scale called Bristol scale. Bristol 4 is ideal. So they look like nice serpents, you know, snakes. There's no, you know, floating, no oily spots, no smearing on the sides. But even despite a really good stool, people still have issues, you know. So I look into deep testing. I like metabolomic testing. So we're looking at metabolites that are coming from the flora, the 100 trillion bacteria. We also have in there yeast, good yeast, and even good parasites, and look at what's coming out. There should be a good balance, no bankruptcy, right? Just like a wealth portfolio, right? You want asset building wealth in there, you know, maybe diversified as well. Stocks, bonds, real estate, blah, 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 right? Same with our gut microbiome too. And what we see is because of antibiotics and just like outrageous stress, people have a bankruptcy. And you can detect this on a metabolomic test. The problem with the metabolomic testing is it won't tell us specific species. That's a problem. You can run a stool kit. Really, currently, the stool kits are pretty lame. I have to be honest. They're very primitive. We're at the, you know, tip of the iceberg of like really good testing. But right now, you can't really see exactly what's going on. First of all, it's the colon. It's the last meter and a half of the whole GI tract, the butt. But we really want to see the disease state area we look at in medical school, right? I actually have a residency as well. So I, you know, rotate with a lot of teams, you know, ICU and internal med. And, you know, for the prognosis and diagnosis, we really want to look, the target organ disease, TOD, is really the small intestinal tract, which is long and huge. The surface area is bigger than the skin, so it's our largest organ. And it's at least as big as a tennis court. That's a huge surface area. So to test that, you know, the bacteria there will release metabolites, and we can pick them up in urine. And that's why I love a urine test. It's called organic acid test. And there's a couple on the market. The one we typically use is called Great Plains.
Great.
Organic acid, yeah. And then I think a new one came out, Diagnostic Solutions Lab just came out. We're going to start using that. So there's a lot of ways to test that now. But again, we don't see exactly precisely the species. You know, it's more of like the net. Like if you look at a wealth portfolio, it's like, okay, well, are you positive? You know, are you 2 million, 3 million, 5 million positive, or are you like kind of zero, like it's just barely there? Or are you negative? Is there so much bankruptcy? There's deficits in all the major diversifications, you know, property, real estate, bonds, you know, stock, all of it's negative. Like that's a lot of our clients now. So how do we resurrect it? That's why I love the peptides. We have a scalp microbiome study using TB4, thymosin beta 4, and they plump this onto like a whole bunch of sick, you know, seborrheic dermatitis dandruff people, and compared it to, you know, about 20 healthy controls. Just with the peptides alone, topically, they were able to resurrect diversity, abundance, and change the terrain to look like very identical to a healthy microbiome for the skin. So instead of having, you know, tons of fusarium and tons of bad yeast like Melazizia, and bad bacteria like staph. We see staph in a lot of diabetic ulcers and on skin, eczema, psoriasis. They were able to switch it to get a healthier profile, less mold, less aspergillus, less candida, but the healthier version of a skin microbiome. And I found that fascinating. But everything we do, there's a double-edged sword. There's a T beta 4 study where there was a raging infection going on. They induced like Pseudomonas into the eye. They put T beta 4 and they saw no change in remodeling. The disease state indicators were exactly the same as placebo. I think if they had used it long enough, they would have seen a lot of, there were other good things they saw, but not the remodeling. The disease state did not shift. A lot of our clients come to us, and as we talked before our time together, everyone's got raging fucking infections in the gut. They're silent. They got Lyme, they got mold, they got like Epstein-Barr, plus like 3 other viruses, megalovirus, parvo, HHV 6, 7, sometimes like raging herpes viruses on their cold sore lips or inside their mouth, or sexual. Everyone's really. So when I look at the microbiome, you asked me about what's the microbiome. It's our firewall.
Mm-hmm.
Whatever it takes for your nutrigenomics, your ethnicity, your toxic burden load to get your firewalls to back up again. And we have kind of 2 channels of life: really fertile, healthy, and then we have 50 shades of infertile. I call it the fuck channel. So we have fertile and fucked. And there's no, in between is not acceptable anymore because people are ill, imbalanced, they're going to get cancer at some point. Estrogens are highly, highly hyperproliferative, driving IGF-1 and all kinds of markers up. So we can shift to fertile. We have great, functional medicine strategies for that, but they're not all like, if we ignore the microbiome, we're not always going to make everything better. And that one TB4 study is one I like to look at because it shows that not everyone is a responder, especially when a raging infection is going on.
Now, and that's amazing to be able to look at it from the testing perspective. Okay, like
Yes.
What are we looking at here, and what does your microbiome look like? And so now for the people who are kind of like, well, how do I get from how I feel to there? I think there's a lot of telltale signs of gut dysfunction, right? And this is kind of like a cool back and forth because I know the ones I see, and it'd be great to see the ones that you see as well. And so one is no one knows what constipated is, and they're like, oh, are you constipated?
Yeah.
No. How many bowels a day do you have? Sometimes one.
They think going once a week is okay. I'm like, oh my God, no, that's not good.
And they're like, how many times a day do you eat? They're like, 5. Yeah. Wait, you eat 5 times a day and you have one bowel movement a day? You're constipated. It's sitting there.
No one told them. Their mama didn't show them. Their doctors are ignorant.
Yeah, and I think that's okay, because if you're not getting good gut motility, it's a problem.
Yes.
That is a big sign right there. And then I'll kind of work. I'm going to work it from the bowl up. I usually start from the bowl and work my way up, right? So let's go back.
That's great. I love that.
Bowl, like you said, the stool consistency, right?
Yeah.
Is it, is it fully formed? Is it watery? Then there's the whole blood, mucus, undigested food, big clues right there. And then
exactly.
And again, no one wants to, but if it's really foul smelling.
Exactly. Yeah.
I mean, it's we know it stinks, right? They say your shit don't stink.
No, it actually should smell like compost a little bit. Like the health. When I do my fiber, it does shift that way.
Yeah, you say shit. You act like the shit don't stink. And I'm like, it doesn't. I'm healthy. So, and we go there, and then we work our way up, and it's just like, okay, this goes into abdominal pain, right? So are you getting distension? Are you getting pain? Or getting bloating? Right. So just
bloating for women is a big deal.
But bloating is tricky, right? Because hormones, right? Hormones, food sensitivity, sodium, all that. But if it's just
for sure, yeah.
But if it's constant, and it's especially after you eat, that's a telltale sign right there. Obviously, nausea, we can go nausea, vomiting, all that good stuff as well.
Right.
And then the other thing I kind of realized, and now we're kind of working our way up, is I think that, fatigue in general, like you go fatigue, and, we can talk for 4 hours on what causes fatigue. But I think especially if you're getting, fatigue after normal meals, like of course if you go eat 4
food coma,
I mean, if you go eat 4 burgers and 3, you're gonna be tired because you put yourself so parasympathetic, it's not even funny. But obviously, like, if you're getting that fatigue, and I call it the trying to push a thought through jello, like I'm like, man, I eat and I just I can't think, I can't work after I eat. And so for me, those are some of that, clinical, like coming in, it's like, we need to look into this,
Yeah.
Yeah. One of the ones I use, just kind of just, again, it's subjective, and it's like, hey, when are you getting nail infections or any type of like fungal issues, and like because obviously,
jockish.
and it's like, wait a minute, like we need to not just
like actually everyone has dandruff. And that actually is a sign your gut microbiome. Yeah. For women, I also look at oxalates. That's what's so great about the organic acid test. Surprisingly, many disease states now are totally, correlated to poor microbiome, missing species. So even like PCOS, infertility, fibrocystic breast, ovarian cysts for men, benign prostate hypertrophy, many things. So any kind of body comp issues I've seen.
Metabolism.
Their stools may be great. Body comp issues, brain fog, as you mentioned, and any fatigue is all highly associated with gut microbiome issues. It just may be silent. Some people go even once or twice a day, nice stools, but when we do deeper testing, the deficits are present. The bankruptcy is evident. And just by switching this, studies show we can change it. Bloating will go down no matter what they eat. We reverse food allergies all the time. A lot of people come to us and they're casein-free, dairy-free, and gluten-free, and they're able to eat gluten and dairy in 4 to 6 months without, ending up in bed, ending up fatigued, ending up with bloating. Awesome. Yeah. So that's awesome. What we want to help with people, because we're able to eat some of these things. I don't know if you look at centenarians, Greg, but I love studying centenarian studies. That's how I formulate my own probiotic, the signature formulations we have. I base it on what's found in healthy individuals that live over 100. They're chronic disease-free, cancer-free. They're not on peptides. They're not on bioidentical hormones.
I need to look into these centenarians a little bit more, because it seems like they truly medically and clinically got it going on. Oh, another one that I'm starting to make a greater connection with is the gut hormone skin axis. Because I'm starting to realize that, gut dysfunction, hormone dysfunction, it presents in, with acne and cystic acne and eczema, and sometimes psoriasis, right? So it's kind of like it's that outward expression of your inner being.
Absolutely.
So I try to, because it's like, first it's like, oh, you have acne, right? And so we go hormones first, right? Like, oh my God, you must have so much testosterone or what's going on here, but realizing that the gut plays a big part of it. And lastly, working our way to the top, mood.
Yes.
Depression.
Absolutely. Yeah. Mood, depression, anxiety, PTSD, trauma, unresolved, not the lack of processing, trusting, you can't trust if you don't have oxytocin. And studies show lactobacilli, especially like strains in our signature probiotic, they're highly associated with increased wound healing and bursts of oxytocin in subjects that are tested and animal studies. They're all interrelated, just like we're all connected through Instagram and Facebook.
I know. And then there's serotonin, obviously we produce serotonin in the gut. And another one is, and I need to pull the string more on this research. I actually posted a question on my Instagram about, and I just found it looking at something else, that we actually produce more melatonin in the gut than the pineal gland. And I was like, I wonder if some of the issues that we're having with sleep is because there's, some gut dysfunction. So,
absolutely. Yeah.
All the cool things, it all starts in the gut. It all starts with the gut, as much as we don't think about that. The gut is it's ever present, but sometimes not paid enough attention to, in my personal opinion. So now that we kind of, we can think about the symptoms and some of the signs of the gut dysfunction, and we know there's testing for it. Now the thing is, okay, now you go see your doctor. I know something's going on. I don't feel well. What are some of those, we mentioned that, the organic acid testing. Are there any other tests to look at to kind of track, not just test the gut dysfunction in the microbiome, but also tracking that it is getting better?
That's getting better. Okay. So we do the organic acid. I have to admit, like, it does take 4 to 6 months to help the organic acid get better. That's just how deep the level of dysfunction I think so many people have in their microbiome, and it just takes time. We also study and look at hormone panels. And actually, I love the organic acid from Great Plains, because they also have the adrenal neurotransmitter pattern. So dopamine, epinephrine, and serotonin. We want to see these all lined up down the median. And I like them because our adrenal glands are the extra sources of our anabolic hormones, progesterone for women, testosterone for men, outside of the gonads. So it's a great mirroring and analogy to what's going on the macro level, right? Two channels, fertility and infertility. So I love looking at the adrenaline markers from the organic acid. And the Dutch also offers it. So we look at a Dutch panel occasionally. A lot of people say, oh, I'm not stressed. And we look at their Dutch and their 4-point cortisol is just out the fucking roof. Or if they quickly metabolize from cortisol over to metabolized cortisol, we'll see their 24-hour cortisone and metabolites of cortisol are just like crazy, either depleted, or off the chart high. But yet their cortisol looks phenomenal and normal. So everyone's a little different. It's their nutrigenomics and maybe even the gut microbiome contributing changes to our enzymes and how, the bacteria love us, and the yeast. So when they make us ill, we are just like sitting around shoving sugar in our mouths. And it helps them because they got this, like, they hijack the house and penthouse and they don't want to go. We, want to move around, oxygenate the body, and then oxygen is antimicrobial. So we get balanced. Studies show just with exercise alone, we shift our microbiome in amazing, awesome ways, right? Like you love muscle, you look hot, like all muscle, right? Our bacteria, the microflora, are like, muscle cells are the red, especially red meat, right? It's full of mitochondria, and it's analogous. Our mitochondria are bacteria long in the days before the intracellular enveloping that happened in evolution, if people believe in evolution. So we're able to use bacteria to get huge nuclear power. Bacteria provided that. So that if our mitochondria are happy, our microbiome will likely be happy as well too. So when we keep our muscles have lots of mitochondria. So when we keep our microbiome happy, our muscles also are going to show it. We have a lot of high performance clients. Like I do MMA programs. I do supplement programs for some MMA fighters, Bellator, UFC, and then we have some, former professional baseball, and other type of players. And, if people aren't making muscle, like, so this is just the metric we track. Like, are you making muscle? And another one I love is called MW, morning wood. Like, dude should be making morning wood. My 70-year-old men eventually make morning wood every day. They even have midnight wood. Well, so if a 20-year-old, 3-year-old, 4-year-old is not, they're not in the fertile channel. They're over here in the tough channel. Yeah. And so they do our protocols. This is before peptides even. In 2 months or less, it's all resurrected. That is a good sign for me. I don't need a $500 test to tell me, oh my God, we help them feel better. And now they're in a higher pro longevity state. I know for sure the telomeres are 25% higher. Yeah. I don't even need to check it. Yeah.
Oh, that's amazing. And again, we to me, it all starts in the gut.
Yeah.
And I think that it's easy. Again, it's sometimes easy to overlook because again, if someone comes in and like you said, your morning erection patients, obviously we think about the hormonal component of that because testosterone is, if you look at the rhythm, it's highest in the morning. But usually if you do your questionnaire and your intake and you're like, all right, well, hey doc, I don't have diarrhea, I don't have bloating, I'm not constipated, you go through the list, it's like, oh, okay, your gut's good, but then it's these other things.
Exactly.
Where it's like, and we discover that sometimes it behooves us to pay attention to the gut and actually work on improving it. Like you said, because if you don't address it, that microbiome is screwed. It is.
It's absolutely right. And there's studies that back up what we do. We have a lot of protocols. I also teach clinicians and coaches, much like you. We have an institute we teach. Tremolin is this amazing researcher out in Australia. He does research out of the School of Pharmacy in Adelaide. So in 2017, he did a study on 33 lean men. They were super healthy. I think their BMI was 19. It's like they're so healthy. They were out in Germany, and he had they're age 18 to 40. And about half got a little dose of gram-negative cell wall. Okay, we all have gram-negative bacteria in our microbiome. And they just did a little bit. It was 0.8 nanograms per kilo, very, very low dose. The cell wall of gram-negative bacteria tend to be really inflammatory, especially if they're of pathogenic species like E. coli, things like this. When people go to a swimming pool and a baby poops in the pool, they check E. coli levels. That's how toxic E. coli is. We all have some. It's no big deal. But it's part of traveler's diarrhea. It's actually part of a lot of gut problems, ulcers and IBD, inflammatory bowel disease, and also reduction in testosterone. So he loaded these healthy dudes, who had great erections, I'm certain, gave them a bunch of not a bunch, it was a low endotoxin study, 0.8 nanograms per kilo. In 6 hours, they're testosterone tanked compared to
Wow.
controls who got no injection. Yeah, that's the men I have. Yeah. So we heal the gut, seal it. It doesn't matter how much gram-negative bacteria you have. If you seal it and your firewalls are up, nothing happens. Nothing gets through it. So they're bulletproof, right? They got the shield up. That's what our goal is. Probiotics will do it. Postbiotics, you and I use butyrate. They can't be on butyrate forever. Their gut needs to make it with fiber, 30 to 50 grams of fiber, hopefully a day. But we have to kind of weed. So we do a bit of weeding. It's like a garden. It's a rainforest, right? Like little Brazilian, little Amazonian rainforest. We have to weed and seed and feed them. They're alive. Yeah. There's not just like a little pill for every Band-Aid, right? It's not like medicine where, we have a diagnosis and we're going to put like a drug or probiotic or supplement for every symptom and side effect. We want to like look at the whole terrain. We do terrain medicine. And I love peptides because over time with stress, many of the peptides we have, they're part of fetal programming and initiating healing. But if we're stressed, as you know, we have something called steroid steal, but we probably also have peptides. Like, when we're stressed, all the peptide levels go down as well. They just get tired and fatigued from pumping out good stuff for us. I think a lot of them too are augmented by bacteria is what I suspect. I think bacteria kind of turn on our peptide secretions, like in the thymus, where we take a lot of our good peptides, right? And other organ systems, like in the gut, the BPC, body protective compound.
Oh man, and I can't wait to when we talk in part 2, we're going to talk more about peptides.
Yes.
That's like I'm trying to rein you back.
You're pacing it, yeah.
Yeah. There's a part 2.
I'm just like planting seeds.
It's we're seeding and feeding is what we're doing here. So
feeding and feeding, yeah.
Before we wrap up part 1, there are 2, and we kind of both of us been alluding to this whole thing about looking beyond like those surface symptoms, and obviously thinking about everything that you're eating and what you're doing. And there are 2 things that I know I see clinically, and it's like, and I hear this, and I'm like, we got to go after your gut, man. And the first one, because is we get a lot of patients coming in, and their doctors put them on PPIs, and they never never took them off, and they never took them off. It's like, here you go. And it was like, and now you've have people like, I've been on Prilosec for 14 years.
Oh my gosh. Yeah.
You're like, yeesh, okay, and that's the big one. So I definitely want to hear some. And then the second part to that is we'll get people who are constantly cycling on and off of antibiotics.
Oh yeah, right. And they help because they have these pathogenic flora, but they never get their firewalls up. Their keystone probiotic to push away the pathogens.
So the way I want to frame this question is because eventually our goal is, say, for our PPI patients is, for me clinically, I'm looking at their diet. I'm looking at, their like what medications they're taking. We're looking at their water intake. All these things that go into it. How do we, all these things, right? But let's start with the PPIs. Once you get someone in that position to wean off, how do we restore them, right? Because that acid has been suppressed so long.
Right. The half-life is like 3 days for Prilosec, the purple pill.
Oh goodness! And then you think about those ASNRs. I always tell people, think about this. This balloon just filling.
Yeah, it's a vicious cycle. Yeah, Western medicine is a vicious cycle. So I didn't even know this about NSAIDs. I learned this recently doing the peptide talks that I did. So NSAIDs, everyone's ibuprofen, Motrin, Feldene, Vioxx, Celebrex, any acre pain, they want to kill it with like a COX-1 or 2 inhibitor, right? Or Tylenol. The problem with ibuprofen and other NSAIDs is that they cause the valve, esophagus, and probably our whole gut lining, gut GI tract to loosen, to relax. And then you throw on a PPI, which studies show is immediately within 1 to 3 months, there's fungal overgrowths. Western docs don't know that. And now you're dealing with fungal overgrowths on top of no acid. Then they get infections, more infections. Without acid, that's our primary firewall for delaying and preventing pneumonia, upper respiratory infections, and then all kinds of GI tract infections. Acid kills everything. I use vinegar to clean my bathrooms. I don't use like toxic garbage like Clorox or whatever. Sorry, Clorox. Vinegar kills everything. It kills mold and bad bacteria, bad fungi, and parasites. That's because we make acetic acid. So that's one of the volatile acids that we make in our gut. It's a postbiotic. Just like we use butyrate in our practices, acetate is like the hugest, it's 60%. We make vinegar all along our vagina lining, the sinus, ear, nose, throat, gut. That's our primary volatile saturated fat. It's a saturated fat, but by definition, chemistry. But vinegar is huge. And so I'll have people to restore after PPI use. I have them consider a little bit of vinegar that they tolerate if they're histamine tolerant or not, like apple cider vinegar diluted into water. Yeah. I like warm water. A major metric I check, it's the cheapest test, is what's your body temperature? The number one vital we don't ever look at in functional medicine. So our mammalian Homo sapien temperature is 98.6 Fahrenheit. This prevented all kinds of infections that plague lizards, reptiles, birds. We're like hybrid animals, right? We burn every energy source, body, complex carbs, fat, alcohol, all of them. I'm a nutrition science major, so they all have like calories. Fat is like 9 calories per gram, alcohol 7, carbs and protein are 4 grams per gram, 4 kilocalories per gram. Well, we have this eternal like high metabolism for a number of reasons, but one is because we don't have to deal with all these infections and co-infections. When we have a perfect good body temperature, we probably don't even get Lyme. But over the decades and millennia, our core body temperatures have gone down and down because we've lost our microbiome. And then along with that, when we have overgrowth in the gut, like fungal overgrowth, so we can't eradicate H. pylori. I used to work on clinics like, oh, how do we get rid of dyspepsia and H. pylori? Well, we don't want to, because good H. pylori, but like a particularly CAG plus strain, prevents us from getting adenocarcinoma, which is a horrible cancer, asthma. Many disease states are associated. People should read Martin Glaser, Missing Microbes. We even track like human migration through our H. pylori in the stools and looking at the DNA and seeing where it merged and left and stuff. It's all H. pylori. And it's a good one. But when we get sick, then only the most wily, tenacious species, which are usually pathogenic, of H. pylori remain. Well, studies show H. pylori lives inside Candida. So if you don't do concurrent protocols like the way we teach it at the Gut Institute, functional medicine is going to fail, especially if you use rifaximin and other really broad spectrum antibiotics. They're going to be on the PPI forever. You'll never get them off. You got to look at the root issue. And often it has to do with the ecosystem in the terrain and then making it worse. And then it becomes really hard. The biofilms of Candida and strep and staph and Pseudomonas and Lyme and the viruses all combined together are terrible. Terrible.
Oh, I know. This is fascinating stuff. And this is just, I feel like we're going into this, and this is such the tip of the iceberg of gut health. I mean, it's so amazing. And there's so much to it. When you think about how many strains of probiotics, and then our gut flora, and then the opportunistic ones, and you're just like, it's mind blowing. But again, it's not super difficult if you have the right practitioner and the right doctor that understands it, to say, okay, this is going on, let's do this, and understand it. And it's such a evolving system that sometimes it's like you're here and it changes. And
because we didn't know anything about it. And now the studies are coming out. And we have to integrate what we know, because it all makes sense. If we just think about it. We don't want to turn our brain off, our practical, critical thinking, questioning brain.
And we just adapt. So that being said, that was an amazing segue to close out part 1, because we want to save some for part 2. We can't give it all away. On part 1. So Dr. Grace, so before we let you go, I want to say thank you for stopping in for part 1. We're going to get into part 2 out to you guys ASAP. But before we let her go, where can we find you?
I am at thegutinstitute.com. And often I'll do Facebook Lives with some Instagram. You can find us on Facebook, The Gut Institute, as well. I have a couple interviews like on Gaia or YouTube. You can look up those as well, or on our website, thegutinstitute.com.
Perfect. And I will have all that in the show notes, the show liner for the YouTube channel. And if you're listening on the podcast channel that you may be listening on, to find Dr. Lou and more info about the Gut Institute. So we are going to say goodbye for now, and as you guys say out there, bugs over drugs. That's going to be the rallying cry for this podcast here. So Dr. Grace, thanks again. And we will be talking to you soon.
Thank you. This has been so fun.